How many times have you seen your patients do this?
As a former PACU nurse,
I can vouch that we do tell our patients about this. We do tell our patients how to use this and why we need to do it. But as you already know, it can take up to 24 hours for the anesthesia gas to wear off. So they may be suffering some short-term memory loss. So they may be talking to you, answering questions, following your directions, but they will probably forget about the most important thing, which is this. So today I just wanted to show you how I interact with my patients, how I educate my patient regarding using this incentive spirometer. And this will not be my usual one sentence per day for my 100-day challenge. But since that challenge is almost coming to the end, I just wanted to do something special. So I'm going to talk to you guys as if you're my patient. And before we start, I just wanted to point out that, this little paper that usually comes with this incentives. Most nurses throw this away, but this actually has really important information in it, which is this little table that shows the number, the goal that the patient should reach based on their gender, height, and age. Because obviously, we don't expect our 95-year-old grandma, like petite grandma, to do exactly same as our tall, healthy, athletic 21-year-old boy. So just make sure you guys see that number before you go into the patient, or you can just bring the whole thing and just calculate in front of the patient. It doesn't really matter. But I just like to do it outside before I go in. Okay, so I'm gonna talk to you as if you're my patient. Hi, hello, how are you doing? How are you feeling? Okay, that's good. So I just wanted to ask you, have you ever seen this or have you ever used this before? No? That's all right. That's what I'm here for. So this is called an incentives parameter, and the good news is that you don't need to remember the name. I know, thank God, right? But it is important that you use this properly, and then I'll show you how to use it. Okay, so this promotes deep breathing exercises to wake up your lungs after having the surgery and open them up. So make sure you don't get any like pneumonia or collapsed lungs that may happen after getting surgeries. So this one, usually the people, the moment they see this, they just want to blow right into it. But it's actually the opposite that I'm going to ask you to do. So first, I'm going to ask you to sit up right, nice and tall. And this will be right in front of your face in the upright position also. And then I'm going to ask you to put your lips around this tip, nice and tight, tightly seal around it. Make sure no air escapes. You can just breathe in normally while you have the tip in your mouth. It's not a part of our exercises, but I don't want you to hold your breath. So whenever you're ready, I'm going to ask you to take a nice, slow, deep breath in, and then you're going to see this little white slider go up. So again, based on your height, age, and gender, 3,500 is your goal, which I don't expect you to bring this all the way up right now since this is our first time, but eventually that's where I want you to bring this up to. Okay, so while you're looking at this, I also want you to pay attention to this little yellow ball. And you see how we have three faces here, and only the middle one is a smiley face. This one shows the quality of your breathing exercise. So when you do it too quickly or too shallow, it's gonna either shut right up or stay on the bottom. So I want you to do it nice and slow, which is gonna make this yellow ball flow somewhere in the middle. So it's very important that you do look at both of them. Okay. So when you take deep breath in, again, like as much as you can, whenever you feel like you're at your max, you can't take any more breath in, then I'm going to ask you to take this little tip out and breathe all the way out. And I'm going to ask you to do this 10 times every hour. And it's actually better if you do this like throughout the day. So instead of doing all 10 at once, maybe like 3 or 4 every like 15 or 20 minutes or so. And since I like you, I'm going to tell you that you don't have to get up in the middle of the night to do this. I know. So if you're watching, let's say if you're watching TV, like every commercial break that comes up, then you might want to grab this and do this like 3 or 4 times at a time. Okay. I know I just threw a lot at you, but it's going to make so much more sense when you actually do it. So let me actually see you do it. So that's how I usually talk to my patient. I know I stutter. I probably missed some information, but English is not my first language. So I think I'm doing a pretty good job. But let me know how you guys feel about it, if you like it, if I should bring more English speaking reels like this. And yeah, just let me know, like write down in comments or message me, whatever is more convenient for you, whichever. And I'll be back tomorrow with a new reel again. So, ciao.